Hello, it is January 2017. This is a 1-year update for the first stage lower surgery phalloplasty procedure. That is where the flesh is taken from your arm, put into a phallus, attached to your body, and then in my case, flesh from my buttocks, both sides, was then put on the arm to replace the flesh taken there. So as you can see, still really not much movement, still looking a bit sore there, but actually beginning to heal quite nicely, probably better around this side. The inside is good, and the scars, particularly here, are beginning to fade quite nicely. Sensation wise is still quite muted, not loads of sensation, but things are beginning to come back to life. It took a little while for my chest surgery as well, and I'll say that that's still improving over time. So a quick look at the chest, and then you can see no body hair, but the scars are just doing their thing. I used to have a little kink here, and that sort of faded, and nipples are nowhere near like the sensation I used to have, but I much prefer this chest. So generally speaking, the recovery from the first stage lower surgery has been good. It was quite an intense surgery, but all round, yeah, not too bad. Quite a while off work, and it was quite difficult getting back into that, but my job can be quite physical, but also it can be a lot of driving and sitting down. But work have been really, really understanding, which is fantastic. Also wanted really to give an update on a couple of other things, because I've got more news and I had to write a few things down because I couldn't remember them all. Right, my injections. I've been on Sustanon 250 since I started my transition, so that was April 2014. Works out about 2 years, 9 months ago, and across that time I've had 45 injections, because I'm sad and I've counted. Initially every 4 weeks, then every 3 weeks, because my testosterone levels were too low. And just had, if you watched my last video, I said that I went to the gender identity clinic and they've recommended Nebido. So Thursday coming, which is the start of February, I will be having my first shot of Nebido. And I have it here. I should have got one of my Sustanons out to show you the difference, because look at that bad boy. That's big. The Sustanon one's like this tall in comparison, about a quarter of the width. So substantially more. I'm expecting pain in the injection site again, but I'm quite excited because rather than every 3 weeks, it'll be every 3 months. But obviously I've got to have my blood test to make sure that my testosterone levels will remain at the right levels. And other really big news, I have a date through for my third and, fingers crossed, final phalloplasty procedure. Woo. This is to insert the, I think they call it prosthesis, but basically the implant that will enable me to have an erection and having balls. So my stage 2 was in September 2016, and I'm having this stage 3 right at the beginning of February 2017, and it is about 4 months after my pre-op, and that's what they told me, about 3 to 4 months. I had resigned myself to another 9-month wait, so this is absolutely amazing. It's going to be at St John's, St Elizabeth in St John's Wood, London. I think I'm in for 2 nights. I go up on the Thursday night after my Nebido injection, have the operation Friday, and then should be discharged Saturday. So it's all really exciting. I had, I think, just less than a week's notice this time. I usually get about 2 days. So it's odd to have a bit more time, actually. I'm not sure if I like it or not. It's quite fun in some respects to have it 2 days notice, because you haven't really got too much time to think about anything. So I have had a little bit more time to think about this. I had my pre-surgery consultation this morning. Sorry, no, I didn't. It was this afternoon. That's just over the telephone. So I asked questions, basically like how do they get it in there, and all he really kept telling me is I'm going to be very sore around the scrotum area. They do go in sort of the side of the thigh around the scrotum area, and managed to get the whole thing in that way. I didn't push it, but I am wondering how they're going to put the length of it through the penis itself. It's been like that for over a year now, so who knows. But this is the operation that doesn't feel as big compared to obviously the first stage lower, which was massive, and then the second stage lower is hysterectomy and connecting things. Doesn't seem as I was going to say significant, but that's not quite right, because actually it's very significant. It doesn't seem, well, yeah, just as big. But this is the one where things can go wrong. So I asked, how long is this likely, the device, is it likely to last? And he said if everything goes well, no infections and no mechanical failures, it should really, it's on a case by case, obviously, they can't always tell, but it should or could last 10 years. But if you guys have done some research, you might find some people on YouTube where they've had a couple of mechanical failures. Some things have not worked out. I've seen it, that's for sure, or I've seen people that reported it, and it obviously it all depends on the individual. So please keep your fingers crossed for a 10-year, but we'll see. So I will update, and I'm going to try and update a little bit sooner after surgery. I've been really bad in the past where I don't update until I'm significantly better, and perhaps don't quite always get the true reflection of how things have gone. My last surgery, the second stage when I had the hysterectomy, I was not prepared for the slump in my mental health. This time I am prepared for it, but I probably think it's not going to be as relevant because this should be my last surgery, and once I recover this time I should be recovering from now on, and that is, it's light at the end of the tunnel. It feels good that both the Nebido and the surgery are coming at the same time, because I can start living my life and not be, well, I've got to see the doctor, I've got to see the nurse, I've got to see the gender identity clinic, I've got to have surgery. All those things are going, and I have my final surgery, I have my first injection of the Nebido. It's going to last 3 months, and then I'm going to have 4 injections a year from now on after the surgery. Job's done. Fantastic. So, as I say, this time I'll try and update sooner after my surgery. I can tell you a bit more about it, how it feels, what's good, what's not. I have been told that I'll be going home with a semi-hard-on because they leave it slightly inflated. A week later I have to go back for a post-op, and they will show me how to inflate and deflate. And apparently it's not straightforward, it is quite difficult, and if you don't get shown you don't know how. Which I haven't quite told my work colleagues yet, because they think it's hilarious that if they might like whack me in the bollocks that I'll get a hard on, but none of us have actually known how to then deflate. So it's been the standing joke in the office that, well, how do you get all the liquid back into the reservoir? But it sounds like it's actually a little bit more tricky than I'd ever thought, and hadn't really done any research on it. I've been very much along the lines of, we'll see how it goes, and I don't always want to know too much, because sometimes that puts more fear, and yeah, so far my approach has worked really well for me, which is I know the sort of where I'm aiming at and the major sort of pointers along the way, but anything other than that, I'll let the professionals deal with that, and if it goes wrong we'll worry about it then, and touch wood, it's all gone really well. So I'll update you soon. Hope everyone's well out there, and yeah, fingers crossed and wish me well. Any questions or comments, please leave them below, and I will try and get back to you. Very interested to hear what people think, and if I haven't covered something or you are curious, please ask. I'm more than happy to answer. Take it easy.